Hello, Facebook. Dr. Gaines here from Family Matters Counseling. I'm going to wait a few minutes. Hopefully, a few folks will get a notification that I'm on and we can have a little audience. I wanted to come on and talk a little bit about my upcoming webinar this Saturday, October 24th at 10 a.m. I know some of you have already downloaded the checklist, but I wanted to come on and say a little bit about what you can expect to learn at the webinar. We're going to be talking about depression in Black women. And I wanted to just say a little bit about, how to recognize some signs and symptoms and why this would be a good webinar for you all to participate in. So some signs and symptoms of depression that I'm seeing right now in many of my clients, just feeling sad, feeling down, and not knowing why you're feeling sad or feeling down. Some people have difficulty with sleep, whether it's falling asleep, staying asleep, waking up throughout the night, lots of racing thoughts or lots of things on their mind that they can't get off. Or some people use sleep as a way to avoid. So you're sleeping a lot more than you normally would. Isolation and withdrawal. I know that can be kind of confusing because we're in the midst of COVID. So we're already socially distancing and isolated, but it's that increased feeling of not wanting to engage with other people. So if you're ignoring phone calls or text messages because you just don't feel up to talking to people, and it's purposeful, not sort of, it's purposeful. You don't really want to be bothered. Feeling irritable or easily agitated can be a sign or symptom of depression. So more easily angered or easily agitated, or just kind of noticing, I don't want to be bothered. I don't want to talk to anybody. I don't want to hear about anything. Snapping off real quick. You got a quick temper. That could be a sign. Eating, overeating, is a big one. Soothing yourself with food, rather than dealing with the feelings that are coming up. You might soothe yourself with food. So that could be a sign. Tearfulness, not even knowing why you feel tearful, but just overwhelming sense of wanting to cry is usually another symptom. One of the things that I want to focus on during this webinar is how we describe ourselves as strong Black women, right? I know I used to call myself that all the time. And so in the webinar, we're really going to dig down deep into, how that's harmful to us as Black women, because it really creates this space where we feel like we can't fail, like we have to show up. We say yes to everything. We overextend ourselves. We're trying to be strong. We take on everything. And we meet the needs of other people without taking the time that we need to take care of our own needs. We often ignore our own needs. And so that really feeds into this idea that we can't acknowledge our own feelings. We don't have our own feelings. And so how do we deal with that? And a lot of times we stuff that down. We don't want to show up as the angry Black woman. So, we stuff a lot of those emotions down. And that creates feelings of resentment because other people come to us, they talk to us about their feelings, they talk to us about what they're going through. We show up for them, we take care of our children, but there's no space for us to acknowledge those feelings. So we engage in a lot of repressing and suppressing of our own needs. So we'll spend some time during the webinar talking about what that looks like and how to deal with that. But this description of ourselves as a strong Black woman is really creating a lot of feelings of depression in folks. And so I want to create a space so we can begin to talk about that and learn ways of dealing with that. We're also going to be talking about ways to cope effectively. Obviously, you know, as a mental health provider, I want people in therapy. But what do we do if therapy isn't an option? We don't have insurance or we don't have the funds to pay for that. How can we cope effectively? One of the most easily accessible ways of coping effectively with depression is exercise. Believe it or not, some people take medication, which is fine too, but another way to get those endorphins and neurotransmitters that we need to have a healthy mood is via exercise. And so, you know, finding ways at home to get that exercise in can be really good. As far as coping, journaling is another way because it provides a release. You can get those emotions out. You can get them off your chest, so to speak. Even if you don't feel comfortable sharing them with somebody else, you can feel comfortable with writing it down, and that's a good way. So I'm really excited about the webinar. We got some folks signed up. We still have space for more people to sign up. So if you are experiencing feelings of depression, or if you're wondering, you know, what is depression? What does it look like? What are the symptoms? We're going to be talking about that. How to help other people in your life who might be experiencing depression. We're also going to dig down deep into this description of the strong Black woman and how that might be creating feelings of depression in us. We're also going to talk about failure, how sometimes we think we mistake failure, and it's really a feeling of sadness and depression. We're also going to talk about coping, how to cope with what's going on with you, and how to access resources to find a provider that can assist you with that. So I'm looking forward to meeting folks. If later on you hop on and watch this video, feel free to jump in the comments and leave me some questions or ask some questions about, you know, the webinar, you know, more questions about depression, anxiety, or, you know, strategies for coping. I'm available, and I want to be helpful. So I hope folks tune in. I hope folks will join us for the webinar this Saturday morning at 10 a.m. And hopefully we'll have a robust discussion. And you'll walk away better understanding what depression is, have a better understanding of coping strategies that you can use and ways of getting help. Before I hop off of here, there are a couple things I didn't mention. One of the, I was talking to a young lady earlier this week who was feeling suicidal, and that can definitely be a symptom of depression. It's one of the more serious symptoms of depression, but some people do experience that, and having somebody that you can talk to openly about that. A lot of times people feel a lot of shame around, you know, having depression or having thoughts of suicide, but being able to talk to a provider who is experienced and can help you deal with those things is always the best option. A lot of times our family and friends, they don't know what to say. They don't know how to help us. And, you know, they can be really quick to talk us out of those feelings, but we really need to create less stigma around talking about these feelings and how to deal with them. So I appreciate you all tuning in. And again, my name is Dr. La-Toya Gaines from Family Matters Counseling, and I'm hosting an upcoming webinar this Saturday October 24th at 10 a.m. You should be able to find the link on my website, or not my website, I'm sorry, my Facebook page. You can find the link to sign up for the webinar. And feel free to drop some questions down in here, and I'll try and come back later on to answer some of those questions. Let's see, you can follow me on Facebook at FM Counseling Michigan, or on Instagram at Dr. La-Toya Gaines Speaks. I look forward to seeing you all at the webinar. Thanks for tuning in. Bye-bye.